I'm Dr. Philip Cofoid. I'm a general ophthalmologist here at Virginia Eye Institute. I grew up in a small town, South Texas, and ended up going to college in Dallas, Texas at SMU. I completed medical school at Texas Tech University out in Lubbock, Texas, and then I did my my ophthalmology training just down the road in Charlottesville at University of Virginia. After I graduated from there, I ended up going back home to South Texas for about 3 years before moving back here to Richmond to be closer to my wife's family, and I'm lucky enough to have found a home at Virginia Eye Institute. Early on in my medical school career, I was lucky enough to follow an ophthalmologist through his practice, and the thing that stood out to me about the field was the impact that you can have on patients. Take a cataract, for instance. A patient could be having a lot of difficulty seeing, and in as little as just a day after the surgery, they could be seeing crystal clear, and you completely change patient's quality of life. And that's something that a lot of fields in medicine don't provide to the patient. So I feel very fortunate to have found the field of ophthalmology, and I love my job every day. My area of interest in ophthalmology is, as a general ophthalmologist, is managing some of the more common eye conditions. The main focus being cataracts, also doing managing conditions like glaucoma and certain ocular surface disease and certain conditions of the body that end up affecting the eyes. There's a lot of stuff we can do for that as well. Patient communication is extremely important to me. I pride myself on making sure my patients understand exactly what's going on whenever they leave my office, and being available to them if they have any questions after they leave my office, if they didn't think of something in the moment. It's important to me that patients know not only what condition that they have and what the diagnosis is, but also know the plan moving forward, and to be an active participant in their plan, because there's, no two patients are exactly the same, and not everyone has the same priorities in the management of their condition. So to get a patient involved, to make sure we tailor the care and the treatment to best suit their needs, is extremely important to me. So when I'm not finding myself in the office, I enjoy spending time with my wife and my dog Frida. I like to spend a lot of time outdoors, whether it's hiking or running or traveling. I also like to play tennis on occasion, but just being outside, out in nature, is one of my hobbies.